Hello, lovely people. Welcome back to my channel. This is Abdul Malik. You can call me Experience One. Today, we are going to look at cervical cancer. Okay. Now, when you talk about the cervix is okay. It's also known as the neck of the uterus or the womb. In a simple term, it means the womb or the neck of what of the womb. Okay. So now, whenever this particular cervix becomes cancerous, that means that there is going to be a very critical issue that we have to look at. Okay, now the cervix is the one that opens into the vagina, and all discharges from the womb or the uterus, okay, passes through this cervix into the vagina. So today let's just look at what is meant by cervical cancer. Now, when you talk about the cervical cancer, we say a malignant tumor of the cervix, which is the lowermost part of the uterus. So whenever there is what malignancy of the cells of the cervix, then that is when, or it indicates that a false cell has replaced a true cell within the cervix, or abnormal cells has replaced a normal cells within the cervix. And you know that they are very dangerous because they have ability to spread. Okay, and you know that cancer cells, in as much as they are not the true cells, okay, their way of function is different from all the normal cells. So in this case, when it comes to the cohesion of these particular cells is no more there, the elasticity of this particular cells is no more there, and you know that in as much as the function of the cells has been altered, it means that healing would find wound healing become a very critical issue that will not be pleasant to the individual who has experienced this. Okay, now we say that this can be prevented by pap smear or papanuclear smear. Now, when you talk about this pap smear, is one of the things that we use to prevent cervical cancer. You know, there is a particular virus, okay, we call it human papilloma virus, that is mostly associated with cervical cancer. We will talk about it under the risk factors. They are very, very important. You know that the metastasis is usually confined to the pelvis, but distal metastasis occur through the lymphatic spread. When it comes to the lymphatic spread of cancer, the lymph nodes or the lymphatic system is very rich enough, and you know that is the area that mostly are targeted. Even though cancer has a lot of target areas, when it comes to the brain, when it comes to the lungs, when it comes to the bones, the liver, the kidneys, and other important organs within the system. These are the areas where cancer mostly spread to. Okay, now, but when you look at the lymphatic system, they are very rich enough, okay, for the early metastasis of the cancer cells. So take note of that. Now let us look at the risk factors of cancer. Now this is where the education comes in, because sometimes we have multiple sex, okay, with multiple partners. Sometimes there are a lot of things coming through the family, the genetic issues that we are going to look at, because in solving the NCLEX questions, okay, which one comes first, okay, and then which one is more associated with cervical cancer. The risk factors of cervical cancer is what we are going to look at now. Now, we have one of them to be the human papilloma virus, okay, or the HPV. Now, human papilloma virus is a particular virus which is very, very dangerous. Now, why am I saying so? It is because whenever this particular virus continuously is being exposed to the cervix, what happens is that they change the activity of the cells in the cervix. Okay, the cells undergo certain changes. That means that there is going to be a particular irritation that will enhance the development of this cancer, okay, under this particular virus. Okay, and it is very, very dangerous. So human papilloma virus is mostly associated with cervical cancer, and they are very, very dangerous. So take note of that. That is why we always tell you to have one particular partner, or if not, you have to do a pap smear, okay, or you have to do the vaccine to be able to protect you from this particular virus or the effect associated with the human papilloma virus, because they are mostly associated with this cervical cancer that you should take notice of. So this is one of the risk factors. And then family history of cervical cancer. If there is a family history throughout your family, okay, genetic factors. If you know that you have a particular family member who has ever had this cervical cancer, then it might be that it is running through the family. So you have to always go for regular checkup to see, okay, so that you don't have the effect of this particular disease called cervical cancer. And also cigarette smoking. Now this one can be active or passive. The active in the sense that if you are actively involved in smoking, then okay, you are at risk for cervical cancer. And then also passive means that okay, when you are closer to individuals who smoke, that means that you are also at risk for that. So take note of that. And then we have the reproductive behavior, including early first sexual intercourse before 17 years. So, when during the youthful age, a lot of people engage into sexual activities even before 17 years of age. And if you are a woman under this, you are at risk for cervical cancer. That is the scientific proof. Okay, so there are a lot of research on that. Okay, so sexual intercourse before 17 years of age can put you at risk of what? Cervical cancer. And also having a multiple sexual partners. If you don't stay to one partner, okay, from you jump from here to the other, okay, you don't know the one that is carrying the virus, okay, that is a bit what that will maybe cross, okay, to infect you to have this particular condition. So having a multiple sexual partners can put you at risk for cervical cancer as well. And then being immunocompromised. Whenever your immune system is highly suppressed, whenever the immune system is lower, you are at risk for this cervical cancer. And also long-term use of oral contraceptives. So if you are a lady, if you are a woman who mostly take in oral contraceptive to protect yourself from being pregnant, then please take note. Or when it comes to the hormonal type of what contraceptives, they are very dangerous because they mostly increase the what the development of cancer. So any form of, let me use this thing, okay, most of the hormonal contraceptives are very dangerous, okay, when it comes to the development of cancer. So take notice of that. So before you be able to to take this medication, read on them which of them do not what contain the hormonal or the hormones, especially when it comes to the estrogen type. Okay, so oral contraceptive, the Lydias, the postnatus, and those medications that you have been taking them, okay, take notice of that. In as much as they contain hormones, they are okay, they are what? They put you okay in danger for this particular cervical cancer. That is one thing that you should take notice of. And also having a multiple full-term pregnancies. We have individuals who are very fertile, okay, with just a particular sex. Night, one short night can just put them at risk for pregnancy. Okay, so all these people, all right, so because of that, they deliver, okay, anytime. They can have a multiple children. A lot of them, some people can deliver 15, 20 those days. All right, all these individuals are at risk for cervical cancer. And then also pregnancy before 17 years. As we said, if you have sexual intercourse before 17 years of age, you are at risk for cervical cancer. Definitely. That means that even if you get pregnant before 17 years, it puts you at risk for this particular cervical cancer. So take note of that. And also multiple birth, as we spoke about it. Now that we know the risk factors, let's go and look at the assessment finding. When you talk about the assessment, it's just like the signs and symptoms. What will be your observations? Okay, what will be the observations whenever okay you have this particular condition? Now there's going to be one of them is foul smelling discharge. So if you are an individual who always see this, okay, there's a particular heavy discharge which is foul smelling or smelling bad, then go and do a regular checkup. Go for a checkup to see what is the cause. It might be just a normal what do you call it, a UTI or urinary tract infection, or it can also be a cervical cancer, and they are foul smelling. Okay, they are smelling very, very bad. When you see all this thing, it indicates to you that okay, you are having it, or maybe a pseudosanguineous vaginal discharge. If he has a particular discharge that is bloody mist, okay, that contains some blood, all right, it's also one of the danger signs of cervical cancer. And then painless vagina, postmenstrual and postcoital bleeding. Now, you see that the individual will have bleeding even after menstruation. It's also one of the things that are very dangerous. Okay, imagine you having bleeding Meanwhile, it's not your period to menstruate. It's also one of the risks, one of the signs that indicate that you might have been having what, cervical cancer. So you have to also go for checkup. Very, very dangerous thing. Or maybe postcoital bleeding after having sexual intercourse. Okay, there is what, a bleeding. When you see all these things, it might also be an indication that you have what, cervical cancer. Very important point. And then also there can be also leakage of feces and then urine from the vagina. Yes, there can be feces in the leakage of feces and urine. It might be that maybe there is a fistula due to cancer. You know, cancer cells are not strong, and then with anything, okay, is what is creating a hole. So a fistula can happen, and then there might be a leakage of urine or feces through the vagina, which is very dangerous. And then dysuria, finding it difficult to urinate, is also one of the things. And then hematuria, finding what do you call it, finding blood in the urine, finding blood in the urine. You know, the cervix, when you talk about the uterus, okay, anteriorly or in front of the uterus is the bladder, and posteriorly or the back of it is the rectum. It means that whenever you have cervical cancer, okay, around anything, any structures around this particular cervix is likely to what, to have the effect, because they can spread to other what we call other structures around it. That makes it very dangerous. So hematuria is also one of the things. And then there's going to be anorexia and weight loss, loss of appetite. The patient cannot be able to eat well and those kind of things. And before you realize, the patient is losing a lot of weight. When you have what, that kind of what do you call it? If you are somebody who is losing weight, okay, without any reason, it also indicates that you might be at risk for what do you call, you are having this particular cancer or not. It's one of the things that also make people, go for checkup. Okay, the person is losing a lot of weight without any reason. The person is eating all right or whatever. Okay, now let us look at the intervention of this particular cervical cancers. Okay, intervention, we have chemotherapy. So we see that with this one, okay, the chemotherapy can be what do you call it, injected. It can be any other thing. All right, so now what happens is that whenever the person of this particular disease is given the chemotherapy, there are a lot of things that we need to do, okay, because sometimes there might be nausea and vomiting associated with it. And in order to reduce fluid and electrolyte imbalances, okay, we ask you to what, to give sometimes antiemetics, and then you have to monitor the patient. If the patient vomits severely, it means you have to call the healthcare provider or the doctor, okay, for assessment and then for intervention. Chemotherapy is one of them. And then we can also do a cryosurgery. When it comes to the cryosurgery, here it's just like trying to this one involves freezing of the cancer tissue so that it can be taken off. Okay, we freezes the cancer tissue so that it can be taken off. And then we have conization. The cone shape of the cervix is taken off. And then this one, okay, you can also get pregnant out of that. That is after treatment. But one thing is that it also makes the cervix incompetent. And then the person, after getting pregnant, okay, it can lead to, what do you call it? It can lead to this particular one, like giving birth early, okay, premature birth and stuff. So take note of that. And then we can also do external radiation. External radiation is also one of the things. Okay, radiation therapy is what we do. So the healthcare provider will ask you of order. And then we have two types. We have the internal and the external. The internal, also known as the brachytherapy, okay, where it is inserted, or here the source is within the patient. And take note, when it comes to the internal source of radiation, the patient, especially the brachytherapy, okay, with this one, the internal one, the patient give out the radiation, or the fluid of the patient is also can be contaminated. So that is one of the things that you should take notice of. So depending on the type of the radiation, take note of that. There are a lot of management. I think I spoke about it in one of my lectures on YouTube. Okay, so please go and search for oncology. I've spoken a lot about them. Okay, very, very important. And then we can do hysterectomy. Hysterectomy is a procedure that mostly people do. Okay, the hysterectomy is very, very important. Why am I saying so? Because here, okay, the uterus is taken off. The uterus is taken off to be able to to protect the individual, okay, and also protect the individual from spreading the what do you call it, the cancer around the to the structures around the cervix. Okay, so hysterectomy can be done to be able to help the patient. Take note of that. Now let us look at post-operative what management after hysterectomy. Vital signs is very important. Now, what is vital signs? It has to do with the checking of the temperature, the pulse rate, the breathing, and even the BP. Okay, all this help to know, especially if the individual is bleeding internally. When the blood pressure is low and then the pulse rate is increasing, that means that the patient is okay. The pulse rate is increasing. That means that the patient is having or experiencing hypertension or fluid volume deficit or having internal bleeding. When this thing occurs, you need to report to the healthcare provider or the doctor as soon as possible. So take notice of that. And then we have to assist the individual to cough. Sometimes during the surgery, there can be what do you call it, general anesthesia given. Maybe the surgery became so much complicated, and then it kept long. So right after spinal, okay, they can just go with this general anesthesia, or they can sedate the patient due to the prolonged surgery. So what happens is that when the individual comes, sometimes the lungs and stuff, we need to try to make sure there's adequate patent airway, and also to ensure ventilation, adequate ventilation in and into and flow of what air, so that oxygen can be what. And also we also try to make sure that the lungs expand well to be able to accommodate what air. Because of this, we have to encourage coughing to clear the airway and ensure deep breathing exercise to be able to get more oxygen. And the range of motion exercise is very important. Why is it so? Early ambulation is what we always talk about because of what issue of pulmonary embolism, okay, deep vein thrombosis. Because whenever blood stays within the vessels for very long time, especially when it comes to the vein, it will start clotting, and then that's when deep vein thrombosis start occurring, and then it can lead to pulmonary embolism. In the NCLEX exams, you have to look at all that. Okay, because of that, early ambulation is very, very important. Or if the patient is in bed, range of motion exercise can also help to prevent this particular one. And we have to monitor the intake and output, because the NCLEX exams, sometimes you realize that the patient after the surgery, the urine output is less than 30 ml. And the normal urine output level is between 30 to 50. So because of that, whenever the urine output per hour is less than 30, it might be that there's a problem. It's either the patient is having bleeding or having fluid volume deficit or dehydration, or maybe the kidney has a problem. Because of that, we have to report to the doctor, okay, for this particular situation. And then we have to monitor the bowel sound. Okay, after the surgery, maybe the patient went for general anesthesia. Because of that, the bowel sound has not returned. If the doctor asks you to feed the patient as a nurse, what you need to understand is that if there is no bowel sound return, you can't give the patient. And I know that the bowel sound has within 72 hours or 3 days to return. So sometimes in the exams, you see that within 48 hours, there is no bowel sound. If the doctor prescribed, okay, you have to tell the doctor, or you have to tell the primary care provider that the bowel sound has not yet returned, and then you keep on monitoring the patient. Okay, very, very important key to take notice of. So don't give the food when there's no bowel return, okay, or bowel sound present, or peristaltic movement, or flatus, or maybe if there's no gag reflex. Never feed the patient because of the risk of what? Vomiting and aspiration. So take notice of that in the NCLEX exams. And also when it comes to the management in general, individually, whether at home or in the hospital setting. And then we have to also try to monitor the incision site for any infection, especially whenever there is abnormal discharge coming, pus or pulmonary discharge, or maybe there is a foul smelling discharge. Okay, you have to take notice of all this particular one so that the patient does not have infection, because infection reduces the healing of what? The wound. Okay, the wound will not heal when the wound is infected. So you have to look at all that. And also, you have to manage the patient under pain. Pain management is also very important. That's why in cancer, you don't joke with pain management. And you have to avoid driving. Instruct the patient to avoid driving. Okay, instruct the patient to avoid driving. Why? Because of what? Prolonged sitting. Okay, because of the prolonged sitting. Tell the patient to avoid driving until, okay, the doctor or the healthcare provider has instructed her to do so. If not, they tell the patient to avoid driving until the doctor or the healthcare provider instruct her to do so. And also, We tell the patient that the patient should not do any strenuous activities, and then also to lift any weight that is heavier than 9 pounds. Okay, because of the issue of increase in abdominal pressure, and you know there is a what abdominal surgery, and you know it can also cause to opening of the wound, okay, which is not the best. And because of that, we say that avoid any form of what heavy lifting, any form of weight which is greater than 9 kg. Don't lift them. Take note of that. And then you have to also avoid sex for 3 to 6 days, for 3 to 6 weeks after cervical or after hysterectomy. Very important point to take note of. So 3 to 6 weeks in the NCLEX exam, there are a lot of questions under this. Okay, tell the patient not to what, not to have sexual intercourse for 3 to 6 weeks, and then you have to monitor for any bleeding or any vaginal bleeding. More than one saturated pad is very dangerous in an hour. Take note of that. Okay, more than one saturated pad, the pad that you insert there, if it soak more than one in an hour, it means that the patient is having an intense bleeding. Okay, it is also very dangerous. So RNs, which of the fevers of your Lord will you deny? So take notice of it, and then you have to pay more attention to your health. Okay, and then regular screening. Okay, regular screening is very, very important. At least every year, go for cervical screening to be able to do the pap smear to rule out all this. Very, very important. And then you can also have a vaccine, okay, for against this human papilloma virus. So take notice of that and have a nice day. RNs, please kindly subscribe and help share the platform, okay, to educate people who need, and those who are also writing the NCLEX exams, to help them identify some key areas. Okay, very, very important. And also for the individuals, okay, to also protect themselves in their health. Take note of that. My name is Experience One. Have a nice day. Bye bye.